In today's deep dive session, we'll unravel one of the foundational pillars of research variables and their types. If you're studying medicine, nursing, public health, or planning to do research, this video is your complete guide to understanding what variables are, why they matter, and how they shape every experiment and clinical study. What is a variable? Let's begin with the most basic question. What is a variable? A variable is anything that can be measured or categorized and can change from one person to another or even within the same person over time. It's called a variable because, guess what, it varies. Let's consider the following clinical examples. A patient's blood pressure might be 120/80ths today, but 140/90ths tomorrow. One patient may weigh 60 kilograms, another 85 kilograms. Some people may have diabetes, others don't. These differences, whether they are numerical or categorical, all variables. In research, we use variables to measure, compare, predict, and explain. The core objective of any scientific study is to explore the relationship between variables, whether one causes, influences, or correlates with another. Classification of variables now. Let's break down variables into different types. So you'll never be confused when reading a paper or designing a study. We'll explore 9 major types of variables, each with real-world clinical examples to reinforce your understanding. 1. Continuous variables. A continuous variable can take any numeric value within a certain range. It's not limited to whole numbers. It includes decimals and fractions too. Examples: blood glucose levels, 82.5 milligrams dl, 109.2 milligrams dl temperature, 98.6 degrees Fahrenheit, 101.3 degrees Fahrenheit. Weight, 67.4 kilograms, 70.1 kilograms. These values are measured on a scale and can vary slightly or significantly. That's why we use precision instruments like glucometers and thermometers to detect even small changes. Continuous variables are essential when exact measurements can influence diagnosis or treatment, for instance. Dosing of insulin based on blood sugar level. 2. Discrete variables. Unlike continuous variables, discrete variables can only take specific, countable values, usually whole numbers. They can't be broken into smaller parts in a meaningful way. Examples: number of children in a family, 1, 2, 3. Number of hospital admissions per patient per year, 0, 1, 4. You'll never hear someone say, this patient had 2.7 admissions last year. Discrete variables often appear in epidemiological studies, when we track event counts like disease outbreaks, patient visits, or medication doses. 3. Dependent variable. A dependent variable is the outcome you're measuring. It's called dependent because it depends on another variable, the independent variable. Example: you're studying whether a new antidepressant improves mood score. The mood score is the dependent variable. In a study on how sleep duration affects memory recall is the dependent variable. The dependent variable is what you want to observe or change through intervention. In trials, this is usually a clinical result, like symptom reduction, survival rate, or biomarker levels. 4. Independent variable. The independent variable is what the researcher manipulates or observes to see its effect on the dependent variable. Examples: type of medication given presence or absence of a condition. Exposure. If you're conducting a study to see if COVID-19 vaccination reduces hospitalization rates, the vaccination status is your independent variable, while hospitalization is the dependent variable. Always ask yourself, what am I changing or comparing? That's your independent variable. 5. Controlled variables. Controlled variables are the ones that you keep constant during the study to avoid them interfering with the outcome. Example: when comparing to antibiotics for pneumonia, you ensure all patients receive the same dose at the same interval via the same route. Why? Because if one group gets 100 milligrams and another 250 milligrams, you can't be sure whether the difference in results is due to the drug or the dose. Controlling variables helps ensure the study's internal validity. 6. Confounding variables. A confounding variable is a hidden factor that influences both the independent and dependent variables, creating a false association or hiding a real one. Example: you're studying the link between alcohol use and lung cancer, but many alcohol users also smoke, and smoking is a stronger cause of lung cancer. In this case, smoking is a confounder. If not controlled, confounders can lead to biased conclusions, affecting clinical decisions and policymaking. 7. Intervening variables. Intervening variables are abstract or internal factors that come between the independent and dependent variables. They're usually psychological or emotional states. Example: in a study to test whether online lectures improve exam scores, a student's stress level, motivation, or fatigue could interfere with the outcome even if the lectures are excellent. These variables are difficult to measure directly, but can influence the final result. They often require tools like questionnaires or surveys to detect their presence. 8. Extraneous variables. Extraneous variables are unrelated to the study objective, but may still affect the dependent variable. Example: you're testing whether diet affects acne, but the participants' hormonal levels, stress, and genetic predisposition are not considered. These can skew the results and create what's called experimental error. Extraneous variables can be controlled by randomization. Matching subjects, keeping study conditions uniform. 9. Organismic variables. These are variables related to the subject's inborn characteristics like age, sex, ethnicity, or genetic makeup. You can't manipulate them, only categorize them. Example: in a study comparing how males and females respond to anesthesia, sex is an organismic variable. While you can compare groups based on organismic variables, you can't use them to establish causation directly because they're not under experimental control. These variables remind us that humans are complex, and we must consider natural traits while interpreting data. Why understanding variables matters? Why go through all this classification? Because if you don't know your variables, your research won't be reliable. Mislabeling a variable can lead to incorrect statistical analysis, misleading conclusions, poor patient outcomes. Clinical research demands clarity, and that starts with understanding your variables, the backbone of your study design. Whether you're doing a case control study, a randomized controlled trial, or a qualitative interview, identifying the right variables helps you choose the right tools, tests, and interpretations. That brings us to the end of this detailed session on variables and their types. Today you've learned not just definitions, but also how to identify, apply, and control variables using real clinical logic. If this helped clarify your concepts, please give this video a thumbs up, share it with your fellow students and researchers, and subscribe for more medical education explained with clarity and compassion. Drop a comment below if you'd like a follow-up video on hypotheses, study designs, or statistical tests. We're building this journey one concept at a time.